Have a kiss? Love you.
Love you.
Have a good day at school. July 25th, 2011 was my second to last mission in Iraq. It was 25 minutes before 1 o'clock. I was kind of wondering what we were gonna play for our next playlist. All of a sudden, there was this loud boom. I'll hear on the radio, Ghost One's been hit by an IED and they're on fire. And the medics there, they told us, you're not bleeding from the head, so you're fine. We don't need to check you out. So we went to bed. The next morning, when I woke up, and I was in so much pain. Came back, started going to the VA, determined that it was my L5-S1 that I herniated, so it needed to have some surgery. As soon as I woke up, I knew something was not right, and they kept telling me that, you know, it's surgical pain and it'll go away. And that's when I went back to see Dr. Coyce, because something had to be done.
Jeff was initially referred to me for his traumatic brain injury. When I got the CT scan, there were a couple unusual factors with his fusion. Number one, he had an atypical fusion device in which there were only 2 screws. Usually we do a much stronger, especially in a younger person, we do a much stronger fusion device. They often have 4 or 6 screws, but this only had 2. And one of the screws was malplaced. Instead of going into the bone, it actually went through the nerve that went down his leg. Because I was still able to use the New England Baptist Hospital, I got him to see Dr. O'Hablum, and he removed the screw.
I'm in pain every day. My leg just goes numb. Sometimes it only lasts a couple of seconds, sometimes it's a couple of hours. My back sometimes will just go into spasms and I can't move. When that happens, I just have to let it run its course. You would have loved that.
You had a problem with, after the botched surgery, that weren't they kind of accusing you of
Yeah.
What, can you tell me about that?
They, because I kept calling them and telling them that, you know, something was wrong, that the pain was not right, and that they needed to do something. And they accused me of just trying to get narcotics for the pain. And I told them, I'm like, you guys sent me home with a bottle of 100 Percocets when I left my surgery 3 months ago, and I still have all of them. I haven't taken a single one, so I'm not looking for narcotics. And then they just finally stopped taking my phone calls altogether, so.
Did you ever get any kind of closure from it? Did anyone ever say case closed?
No. Nope.
No apology?
Nothing. Nothing. It was all, the only thing they ever said to me was, the pain you have is normal and it's gonna go away.
Has it gone away?
No, it's never gonna go away.
These people should lose their licenses. They should be subject to massive malpractice. And yet, none of that happened. It was a toxic culture. We were just appalled by what was happening, and things were being covered up, things were being buffed so that it looked like we were doing well. Eventually, the Boston Globe contacted me. The title of the Boston Spotlight article was "4-Star Hospital Basically Fails." And that's essentially what it is. On paper, we looked like we were a 4-star hospital, and yet we couldn't provide standard service to our veterans.
President Lincoln's immortal words in 1865, "To care for him who shall have borne the battle, his widow and his orphan," really define what the VA was meant to be. Is to care for those who are wounded in combat, and by extension, perhaps combat training. And that was the primary mission of the VA. The real growth came after World War II. You had 16 million returning, millions of whom were wounded, lost 400,000.
And we didn't have a hospital system in that time. America didn't have the infrastructure as a country that it has today in healthcare. So you had all these people who needed healthcare, hospital care in particular, didn't have it. And so we built the veterans system that we now think of to start to respond to that.
Then it began to expand. So it had this vast footprint across the country, east, west, rural, mountain west, everywhere. Hospitals began to spring up.
It's gotten huge to the point of today, the Veterans Administration has the second largest budget in the government, next to the Pentagon. So you've got the Pentagon, then you have VA. There are more VA employees today than we have members in the U.S. Marine Corps.
The VA has evolved into what I sometimes call a box-checking bureaucracy. Piece of equipment needs to be purchased. It was purchased, check. Was it really the right purchase? Was it really a fiscally responsible purchase? There's no box for that. And so just that stuff got done is really the end game at the VA throughout the system. So it's not surprising that there's no personal accountability for performance within the system to get things done right or to get them done well.
They have a lot of good clinicians in the VA. Unfortunately, they work in a system that's, doesn't allow them to do what they need to do.
Only on 12 News, a cancer patient secretly records his visit to a VA doctor.
And that doctor you're about to hear is shockingly blunt about not being a fan of the VA. He also tells the patient he feels that his job is impossible.
Team 12's Joe Dana has the exclusive recordings.
Using a recorder on his cell phone, cancer patient Steve Cooper secretly documented his June 28th visit to a physician at this Gilbert VA clinic.
Is the VA the best system in the world? No. I can only do what I can do. I got given 500 patients on May 23rd. 500. So it was impossible.
I mean, sorry, I appreciate that, but I think you can appreciate my perspective. When I'm battling stage 4 prostate cancer, I don't care, frankly, sir. I just need to get the quality care, right? I think that's part of the VA's problem, right? There's something wrong.
There's a lot wrong. I'm not a big fan of the VA. I try to do a good job. Did you want to listen to your recordings? You're not going to be able to do it.
No, it's fine, sir.
I'm just going to say, key exam time.
You know, and this is on the heels of, the Phoenix VA failing to diagnose my cancer, which became a stage 4 cancer. I really feel like these tapes show that the system is completely broken from its core. Around 2011, I started not to feel too well. It took about a year to get an appointment at the Phoenix VA. Finally, 2012, I met with a nurse practitioner. She had found that I had a large asymmetrical prostate. So the urologist brought me in and said, "I'm sorry, son, I don't have any good news for you. You've been dealt a bad hand. You've got one of the worst cases of prostate cancer I've ever seen in my life. The hospice will call you Monday morning." for most people that I spoke with, you know, it's obviously the worst moment of your life. I came home. I put the gun in my mouth. I looked at a lot of reasons to kill myself. I looked at the reasons not to kill myself. And there were two, my mother and sister. You know, for 18 years, I did the best I could in everything that I was assigned. You know, I really enjoyed my time in the military. I'm proud that I got to serve along with many heroes. Being let down by my government, the country that I served, that I was so proud of, it was even a bigger blow than the diagnosis itself, if that makes sense.
Where's it going? Where's it going? Where's it going?
Because of the type of war it was, and because you had the same veterans going to combat over and over again, you didn't see massive influxes. You had a lot of veterans who would have died in other wars, came home wounded. So you had a different type of warrior, and so the VA was slow to adapt. They just continued to operate the way they operated in peacetime. These are recipes for disaster, and that disaster happened in 2014.
The Department of Veterans Affairs is under fire over allegations that administrators in Phoenix kept a secret waiting list to hide delays in patient care.
Investigators reviewed more than 500,000 emails and documents from up to 42 VA medical facilities. They uncovered a number of types of scheduling schemes designed to give the appearance of shorter wait times, a key factor in bonuses and pay raises.
If Central VA in Washington demanded that veterans be seen within 2 weeks of requesting an appointment, if that was impossible, you had to make a phony wait list to make it look good so you could give the right data back to Washington. And everybody was happy. This is the way everything's run at the VA. Of course there would be secret waiting lists.
And that's about bureaucratic culture and a lack of accountability. It's not about needs. It's not about the budget. The VA has a huge budget.
Because you had the media attention on it, and because the general public finally understood what was going on, they were outraged. And that outrage actually led to the choice legislation, the Choice Act, back of 2014.
The idea behind the Choice Act was that if you had to wait longer than 30 days for an appointment, or if you lived more than 40 miles from a VA facility, then you can ask the VA for permission, and you'll get a card that allows you to go to a local physician or a local hospital.
We're fishing for white bass. They come up out of the lake this time of the year and up into this river to spawn.
Before you had your surgery, could you get out here and fish?
Yes, but I had no standing up whatsoever. If I were to try to stand up, I'd fall in the water. When you talk to some people about why so many veterans have the problems with the knees, mostly it's because of what we did in Vietnam and how much weight we carried on our back every day. Every time we went out, we had more weight on our back than what we weighed ourselves. It finally got to the point of where everybody that I saw said, well, you've got to have knee surgery. So I waited about 4 weeks. My wife had just about all she could stand of what was going on.
When Jimmy finally decided that his knee had gone, he had walked on it as long as he could, he went to Overton Brooks to see about getting the surgery. Of course, they said they did not have an orthopedic surgeon, so then he was going to use the Vet Choice program. And they gave us a couple of names of doctors in Texas, Longview, Texas, which is 60 miles one way. Yeah, more or less, from here. So that was unacceptable to both of us. Plus, those doctors, we did do some checking into their histories, and they were not preferable to us. We did not want them. So I got the phone book and went through all of the doctors that are with the Willis-Knighton system, which is one of the top 100 systems in the country. So I called all the doctors, and then we went to Jerry May when all of these people said no.
There were a lot of veterans here, it turned out, who were voicing similar complaints, that they could not get in to see a specialist, and the specialist kept telling them it's because we can't get paid. It's called Veterans Choice, a VA program started 3 years ago as a way to cut wait times for veterans who need to see a specialist, maybe a cardiologist, an ophthalmologist, or orthopedic surgeon. But Veterans Choice has left some veterans with no choice. Confidential sources from Overton Brooks VA Medical Center in Shreveport say there's a lack of specialists participating in the program. The delay means that veterans can sometimes wait months for test results and life-extending or life-saving follow-up care like pacemakers. And now more VA workers are on the way again to hopefully end the painful wait for veterans like Jimmy Jeter.
I'm just hurt that the VA does not follow through on seeing that you get some help.
Jerry May got the story, and he aired it several times on TV on the news program, and it made these people sit up and take notice. And we were able to get with Scott Bicknell, Dr. Scott Bicknell, an orthopedic, and he did Jimmy's knee surgery, and he was great. The hospital stay was great. TriWest paid within a month. We stayed on top of it. They were very good, and Jimmy's doing great, and we're happy about that part of it at this point.
I feel like the VA owes me something. I have suffered almost daily for over 50 years. I just believe this red, white, and blue that I have always been in love with owes me a little more than what I'm getting right now.
This is basically a, these are, most of the pills that I've tried I've tried them and they haven't worked. So I have like ridiculous amount of prescriptions. I've been on at least 50 different prescription drugs and combinations of drugs. And then these are the ones that I take right now. I got like a whole drawer full. It's overflowing.
Are you ever conscious of people like looking at your leg?
Oh yeah, everywhere I go, somebody's like, "Oh, what happened? Oh, that looks like it hurts." I had a training injury to my ankle while I was in the Army. 1997, the Army doctors fixed the ligament. It was never really right after that.
Get your right hand right up on the exam chair, please.
2015, I was just walking down a flat sidewalk and my ankle just rolled sideways. And it fully tore the ATFL ligament. It tore almost all the way through my CFL, and then it partially tore a bunch of tendons.
So, I know your leg is pretty touchy, sensitive.
Oh, yeah.
But I do need to scrub your
Okay.
leg. It's gonna be with some 4x4s and some hippo pens. I'll try to be as gentle as I can.
Okay.
Sorry.
It's all right.
If you need me to stop at any point as I'm cleaning your leg, let me know and I will.
Okay. I took a lot of pain pills before I came. The private doctor looked at my ankle for about 3 minutes and said, "We can't do surgery. You have something called CRPS. It stands for Complex Regional Pain Syndrome, which is basically a nerve condition that came from the trauma of the injury." And they said they can't do surgery. It'll make it much worse.
Lift up. I'm just gonna try to get back here.
I've probably seen, 3 dozen doctors and nothing's helped. It just keeps getting worse. One of those things that it's just the gift that keeps on giving, basically.
How are you?
Surviving.
How are you? We're gonna go with this Epifix to see if we can get this thing healed up, but we're gonna have a light dressing on there. Will you be able to tolerate a dressing?
The wound is like moving down. It's like because it just oozes stuff all the time. And then like the ooze just like sits there and it stays moist, I guess, on the skin that wasn't wounded.
Well, let's give it a whirl and see if it works. Nothing else has worked.
Okay. My outside doctor had told me that if it had been diagnosed and treated within 6 months, they said there's like a 90 to 95% chance they could have just made it go away as if it never happened. It's been life-changing, and it didn't need to be.
All right,
Thank you.
I gotta run. So I will
Sorry
be
to be
gone
so
next.
chatty.
I'll be gone next week.
Definitely had a different idea from talking to the recruiter of how things worked, and we thought, when you go in the military, they take care of you, and any kind of injuries you had would be handled. That's been a big disappointment.
How's it going?
Is it nice out there?
It's really nice.
Is it?
It's gonna be warmer tomorrow though, like 40s.
Ooh, awesome.
I need a hug. Good to see you too.
And so this was when he was on that trip to West Virginia.
Yeah. And then that dog loved Jordan because he would go and sleep with him when they were at the cabin.
Oh, funny.
Those are his 2 roommates that tried to resuscitate him when he passed. I mean, can you imagine being in your 20s and finding your roommate dead at 25?
What do you miss about Jordan the most?
I think I just miss his personality, his smile, and cracking jokes all the time, and he always made us laugh.
Yeah. My kids both have his smile.
Mm-hmm.
And that means more to me than anything in the world. It's so special.
With the war and everything going on, I think he just felt a sense of like he owed America. You know, like he wanted to give back to America. We were so proud of him to join that because the Marines are difficult and it's, you know, longer boot camp and such, but he loved it. That was his fit. He fit there. And he was going to make it a career. He wanted to, you know, go the full 30 years and make it a career.
On this month's edition of Crossroads, we bring you several events and happenings from Marine Corps Base Quantico and the surrounding areas.
He hadn't had a seizure in 16 months. Bonnie took him to the emergency room at St. Cloud Hospital. And they said, well, you need to see your neurologist down at the Minneapolis VA. We had to wait for a letter from them. This was the beginning of October, and when we got the letter, he couldn't get in until December 21st. We had Thanksgiving. My husband took him home, and that was the last we saw him.
Father, we ask once again, as we will many times in the days ahead, that you would just cause the memories of Jordan to be sweet and frequent. And that, Lord, in your time, you would bring comfort, peace, and joy in his memory, Lord, to the family and friends.
His roommates found him sitting at his desk with his head down. He had a bruise on his head and his nose from falling face first. And they tried to revive him. They were working on CPR, and they had somebody call, and the ambulance came, and the paramedics worked on him for 45 minutes, and they couldn't bring him back.
We're heading down to the Phoenix VA for a town hall meeting. A good opportunity for veterans in the community to express their concerns to the Phoenix VA leadership. You know, I, like many others, don't want, you know, what happened to me and my fellow veterans to go in vain, right? I've gone through hell, and I want to see good come out of this. Right now, things are, I think, I would argue, worse than they were, you know, before the scandal.
I know.
I mean, I just gotta ask.
Yeah, you're welcome to ask.
You know, the choice legislation helped a little bit. That's why The numbers of veterans who now use the community care, use the private sector, has grown from 20 to 36% over the last couple of years. But the problem is still there. The systemic problems are still there, and we don't know, because we don't have the attention focused on it, how many veterans are suffering right now because they're still trapped in that system.
Every body that has investigated the VA since 2014 has said that the VA needs fundamental reform. And yet, layering the choice program over the existing VA is not transformation. And it couldn't possibly uproot the problems that are leading to unnecessary veteran deaths all over the country while we sit around and imagine, what small reform could we institute next?
Initially, it was all like, okay, you're having nightmares, we can take care of that with some, with some Remeron. You're having difficulty sleeping, you feel depressed, you don't find joy in the world, okay, let's give you some Seroquel for that. And, my biggest fear was that I was gonna be just that another veteran that everyone talks about, that everyone seems to kind of picture when they talk about, Iraq vets, or just any vet from any era. It's like the crazed guy who can't control his emotions. A lot of my friends had kind of suffered that same process where they were given, a boatload of medication. And not for anything, like I was scared. I thought this is me, this is gonna be my life, and that's the last thing that I wanted. So I stopped going to the VA. Thank you.
Thank you. Checking in?
Yep.
You can have a seat.
Hi, wanna come in? One of the questions we had to answer early on, and we've answered this on Capitol Hill, we've answered it in forums across the country, is why wouldn't the VA know better about how to treat mental health when it comes to veterans, because it's a veteran-focused and military-focused organization? And how could a civilian therapist, for example, ever do a better job? Hi, you want to come in? Yeah. What we tell them is this: if I want to go to the best heart surgeon, I don't ask that heart surgeon, are you a veteran, before they address my coronary disease. You want just the best person at it. Is that okay? Drift a little bit?
No, I got it.
Yeah?
No, it's so, yeah.
Okay, all right. Let's do this. Rather than you telling me in any great detail the scene or the target, maybe you can just, in the most general of terms, tell me a target you'd like to work on today.
Can I call it just a name?
Sure.
Dirty Boots.
Okay. 3-0.
Dirty.
Oh, dirty.
D-I-R-T-Y.
Uh-huh. Perfect. All right. Okay. And when you think of that target, what picture represents the worst part of the memory?
A blood stain.
Okay. Okay. So Miguel, when you think of the picture, what emotions do you feel?
Frustration.
Anything else?
Probably guilt.
We're picking therapists that have chosen as their primary focus, trauma, trauma clinicians. So that means they're trained in every possible aspect of trauma, and they've been doing it for a long time. This is an unflappable crowd that knows how to do what is needed in these cases, and why not have the best? Just another question or two, okay? So when you think about the scene with the emotions of anger and frustration and guilt, with the body sensation of it in your chest and your heart racing, what negative thought do you have about yourself?
I failed.
I failed. Okay. If you said, you know, we're only going to have this subgroup of Americans or that subgroup of Americans go to just this hospital, you know, you could look at it as, well, that seems like discriminatory in some way. You know, these are people we really, really want to honor. If they could have that same service at any place that they would want to go, I would think that would be an incredible way of saying thank you to veterans. You did a lot of great work today. I hope you're proud of what you did.
Mm-hmm.
And next week we will go back to that targeting, unless of course something comes up in between, and then we'll focus on that. But if we can, we'll keep going with this until we get this all closed out.
Okay.
Sound all right?
Yep.
Okay, good.
Thank you.
You're welcome.
How'd that go?
It's tough, I guess. A lot tougher than I thought it would be, but still good. It's like, just lets you know it's like another milestone that you know you got to reach. And you know, if I keep hitting these milestones, like it just gets easier, you know. It wasn't until I started with Headstrong where I could move forward. I could even almost tell someone that I had lost that I did my very best to save them. I could finally give myself peace.
This is the most amazing aspect of all this. The nurse working at the VA hospital has better health insurance than the veteran who she cares for has. Because the nurse who works at the VA hospital has the Federal Employee Health Benefits Program, where you get private insurance like Blue Cross, and you can go to any private doctor, any private hospital you want.
Yeah, we built a system, but we've got to be honest and say, well, if this system isn't up to standards that are available, why are we forcing our veterans to be limited to that one option?
This is America. What is it that we send people overseas to fight for? Freedom of choice. And you don't give it to the veterans who fight for that choice every day.
I get these messages all the time. So you see here, here's a veteran that just said, Steve, when's the best time to call you Thursday? I'd like to discuss my options for getting the VA to pay for my medical issues. They caused me when they failed to properly treat me at the emergency room. So that's pretty typical of the type of inquiries that I get every single day of veterans needing help.
I recall the day I was diagnosed. I knew that my life would change dramatically, not just physically and emotionally, but also, you know, what I did for the rest of my life.
I think it's great. That way he has a chance to state his concerns, and then we'll try to take it from there and get him what he's earned. I love it.
My focus is helping veterans get the best health care they can and trying to receive the benefits they've earned defending our nation. Now we have a unique opportunity in history to actually affect change. And so I'm optimistic that before I die, every veteran will have the choice to pick who they want to see for their health care.
Okay, cool. I'm glad that we've got this worked out. Thank you so much.
Thank you. See you tomorrow. All right, bye.
I will. But, you know, I'm gonna boil this over and turn it on, and then I'll sit down and forget about it. Will you watch that if I sit down?
I will.
I haven't put it in. I'm just waiting for it to boil.
It's affected everything in our family. You know, she's been in the hospital every other month for the last year and a half.
You got a kitty? What's your kitty's name? Dancy is your kitty's name? Does it dance?
Just when you think you're going to get some help, it's like there's another roadblock. And then, you know, it's been a lot of hurry up and wait. And it's been a lot of just thinking that you're going to get health care and then finding out that, you know, if she had been getting health care all along, we wouldn't be in the situation that we're in.
If VA was treated where the funding was tied to the veteran, and the veteran can either choose to go to the VA or choose to go to private care, and if they choose private care, their funding goes with them, I think VA would very quickly start caring about satisfying their customers. So now you know green things aren't all bad, right? You don't have to be afraid of green things.
The VA isn't doing anything unique. They do prosthetics out in the, you know, civilian healthcare community. They do psychology, all those things, psychiatry, PTSD, their groups. So to me, that's an invalid argument that only the VA can take care of veterans. Because we know it's not true. The VA sends veterans out to civilian specialties and doctors.
Thank you, babe.
Sure.
Good morning.
I've done physical therapy up at the VA. They don't have all the equipment that they have here. And the people working on you do not seem to be as well trained as they are here. I had to call the head of Tri-West and ask them if they could move my services to here. They don't always do that, but they did for me, so. It's much closer than going to the VA hospital or any of the other physical therapy offices in this area. And I like the service that you get here, so. Okay, bye-bye. Thank you, Regina.
We have a legacy infrastructure. We have changes in healthcare delivery in America. And the VA, to a degree, is what it in the past.
The apportioning of resources towards an infrastructure that was a response to a crisis in the 1940s and 50s may not be the smartest thing for us to feel obligated to perpetuate in the 2010s.
You can stand on it. Here. Do not bang on the window. Okay? You know, I think that we should have a choice, regardless. Sometimes you feel like a prisoner because that's all that's available to you, and a lot of it is subpar treatment. And it's funny because some people have no problems at all with the VA, and other people have nothing but problems. So I think it's definitely a case-by-case basis. I have a family physician that's like 2 miles from my home, but because my primary care physician's in White River Junction, that's where I have to go. I mean, I could just bypass the VA altogether, but then I'd have to use my own insurance to pay for it, which isn't right either, because this is stuff that I didn't have before Iraq, so they should be paying for it.
We're at a turning point now that if we don't reform the VA, then it's not going to happen. And if it doesn't happen, the system is going to collapse. So This is critical.
We don't hold ill will towards the VA. I mean, it's a program that is there and gives more help than those veterans would have without it, but it needs to be clean, right? It needs to be top-notch, right? We expect our military, we expect our Marines and our Army front lines to be top-notch. Why can't we give them top-notch care when they get home?
It's not about politics. That's the thing that I think they have to get rid of in their mind in DC, is that it's about the people, it's about the veterans, and what's best for them, not what's best for the Democrats or what's best for the Republicans.